This video will focus on socioeconomic indicators in nursing. We will explore how these measures influence health status and their importance in community health nursing. As Mahatma Gandhi said, "The future depends on what you do today," and great work is done not by strength but by perseverance. Socioeconomic indicators are measures of social and economic development that directly or indirectly influence health status. They measure factors affecting health, emphasizing that health is a social product. These indicators are important in nursing for assessment, helping to identify high-risk families. They guide planning for resource allocation and confirm that poverty is a root cause of many diseases, such as TB and malnutrition. The key socioeconomic indicators we will examine include housing, literacy rate, family size, GNP or per capita income, dependency ratio, unemployment, and socioeconomic status scales. Housing is a part of the physical environment. Criteria for safe housing include good ventilation and lighting, a safe water supply, sanitary waste disposal, and avoiding overcrowding. Overcrowding is defined based on persons per room. Understanding these criteria is important for health assessments. The literacy rate is the percentage of the population aged 7 and above who can read and write with understanding. Female literacy is especially significant, as it strongly influences IMR, MMR, and fertility rates. Family size refers to the total number of persons in a family. A small family norm is crucial for community health, as large families can lead to malnutrition, crowding, and increased infectious diseases. GNP is the total value of goods and services produced by a country in a year. Per capita income, calculated as national income divided by total population, determines purchasing power for essentials like food and medicine. Here are some quick facts. The literacy age cutoff is 7 years. Overcrowding in one room is considered more than 2 persons. Female literacy is the best indicator for IMR reduction. The dependency ratio is the ratio of the economically inactive population to the active population. A high ratio, common in developing countries, places a burden on the working population. The unemployment rate is the percentage of the labor force that is jobless and looking for work. Its health impacts include psychological stress, inability to afford healthcare, and malnutrition. Poverty, especially absolute poverty, is the inability to meet basic needs. Being below the poverty line is defined by the government. Poverty is often called the parent of disease, creating a cycle of sickness and poverty. Socioeconomic status scales are tools used to classify families into social classes. Key scales include the Kupaswamy scale for urban areas and the B.G. Prasad scale for both rural and urban populations. The Kupaswamy scale is the most popular for urban populations. It is a composite scale based on 3 parameters: education and occupation of the head of the family, and monthly family income. The Kupaswamy scale uses a point system to score the education level of the head of the family. This scale also scores the occupation of the head of the family using defined categories. The family income parameter changes frequently due to inflation and is scored from 1 to 12. A score of 12 indicates high income, and 1 indicates very low income. After calculating the total score from all 3 parameters, the family is classified into one of the 5 social classes defined by the Kupaswamy scale. The correct answer is type of housing, which is not one of the 3 parameters in the Kupaswamy scale. The modified B.G. Prasad scale is applicable in both rural and urban areas. It is simpler than Kupaswamy because it relies only on per capita monthly income and must be constantly updated based on the Consumer Price Index. The B.G. Prasad scale classifies the population into 5 social classes based on per capita income, ranging from upper high to lower. Choose Kupaswamy if the study is strictly urban. Use B.G. Prasad if the study involves rural areas or compares rural versus urban populations. The Uday-Parikh scale is specifically designed for rural areas. It uses 9 detailed parameters, including caste, occupation, education, land ownership, and house type. Limitations of the Parikh scale include its detail, making it time-consuming. Also, parameters like caste may not be relevant for rapid health surveys, making it more suitable for sociological studies. This chart summarizes the key differences between the Kupaswamy, B.G. Prasad, and Uday-Parikh scales, highlighting their applicability and parameters. A rapid review of scales shows that Uday-Parikh or B.G. Prasad is suitable for rural areas. The maximum education score in Kupaswamy is 7, and B.G. Prasad uses per capita income. The Physical Quality of Life Index, or PQLI, measures the well-being of a country. Its components are literacy rate, infant mortality rate, and life expectancy at age 1, ranging from 0 to 100. The Human Development Index, or HDI, is defined by the United Nations. Its components are longevity, knowledge, and a decent standard of living, ranging from 0 to 1. This table highlights the differences between PQLI and HDI. Note that PQLI does not include income, but HDI includes GNI per capita. The Multidimensional Poverty Index, or MPI, replaced the Human Poverty Index in 2010. MPI is a complement to HDI and measures deprivation using 10 indicators related to health, education, and living standards. The correct answer for the range of the Human Development Index is 0 to 1. The key dynamic factor in the Kupaswamy scale that changes frequently due to inflation is per capita income. Overcrowding in one room is defined as more than 2 persons. Reviewing the indices, HDI life expectancy is at birth, while PQLI uses life expectancy at age 1. HDI includes income, and MPI includes 10 indicators. In summary, socioeconomic indicators indirectly measure health. Kupaswamy and B.G. Prasad are key SES scales. PQLI and HDI are essential quality of life indices. The community health nurse's role involves using scales for family assessment, resource planning for poor patients, tailoring health education to literacy levels, and advocating for better housing and sanitation. Remember, there is no elevator to success. You have to take the stairs, study hard, and stay consistent. Thank you for watching this video. All the best for your exams.